Hello and welcome to The Vaccine. I'm Jeremy Fernandez. The situation in New South Wales goes from bad to worse. There's a record number of cases and more people are losing their lives in this pandemic. And now there are growing fears for rural centres and vulnerable Indigenous communities. ACT residents are locked down for the first time in more than a year, while in Victoria, mysterious COVID cases have health authorities on high alert. It comes on a day when a record number of people were vaccinated. Casey Briggs has more.
Hi Jeremy. Well, 40 people have now died through this New South Wales outbreak with COVID-19, and the pressure on our hospital system is unfortunately still growing. On Friday, 391 people were in hospital with COVID-19, 63 in intensive care and 30 on ventilators, and I don't think there's any doubt those numbers will keep growing as the cases keep growing. We've got now 390 new cases recorded on Friday, a record for the state, and it doesn't take much to see that these cases are still growing. In fact, the pace the curve is growing may even be starting to pick up now as well, which means we are holding on for dear life in many ways, hoping that the case numbers don't grow too quickly to prevent more outbreaks being seeded in places we don't want to see them, in schools and places like that, but also regional areas like the Hunter and Newcastle area and Dubbo and Western New South Wales. There are other states in lockdown, of course, as well. We've got Victoria, which recorded 15 more cases on Friday, smaller than the day before, but kind of a status quo position because there were actually slightly more cases out in the community while infectious and the same number of mystery cases as the day before. We're still seeing mystery cases popping up every day in Victoria, some of them genuinely mysteries with no links back to exposure sites or index cases at all, no leads at least at this point, and that includes people like delivery drivers and warehouse workers, where, this is the kinds of settings where we've seen significant spread before, both in Sydney right now and in Melbourne last year. So a lot of work to be done to mop this up if this lockdown can even end on schedule. And then the ACT, the newest territory into the lockdown areas as of this week, a cluster of 6 cases, 1 index case, 4 cases linked directly to that one, but then again, 1 genuine mystery. So there's a bit of work there to be done in the ACT. Unfortunately, this one may not get resolved in a couple of days, as you might have hoped, because there's a school student who has a list of exposure sites, a lot of people in the community who have been exposed to this virus. So quite a lot of work there as well, unfortunately, in mopping this up.
The impact of the outbreak on people's mental health is clearly taking a significant toll. Joining me now is Dr. Zena Burgess. She's the CEO of the Australian Psychological Society. And John Brogden is the chair of Lifeline Australia and a former New South Wales Liberal opposition leader. Welcome to both of you. John Brogden, is it possible to quantify the scale of the impact of this pandemic and successive lockdowns right now?
Look, it is using some figures that are available, and as the chairman of Lifeline, I can give you the figures that we're seeing. We hit records in 2020 in terms of the largest call volume in our then 57-year history. We've topped those in 2021. Indeed, last week we saw the highest in our history on Monday, topped with the highest in our history on Thursday at 3,425 calls in one day. To put that in perspective, Jeremy, that was 2,400 calls just 2 years earlier.
Dr. Burgess, are particular people more vulnerable than others?
Well, I think what I can say is people who live alone are finding the lockdowns and COVID quite difficult, particularly because of the social isolation. And people with pre-existing mental health conditions are certainly finding it more difficult because they're exacerbated. Plus, it's harder for them to access services that they would normally go to. And the reduction in social support because of the lockdown restrictions is harder.
Mr. Brogden, economic security is part of the equation too as well, isn't it? Do you have a sense of whether longer lockdowns that are more accommodating of freedom for business, for people to go out and draw an income, is better for a person's mental health over the more blunt sort of systems used in states such as WA and Victoria, where you have these short, sharp, sudden and unforgiving lockdowns?
Look, Jeremy, there's no doubt that one of the things that is driving people's mental well-being and driving down people's mental health at the moment is the concern about money. It's the concern about financial security. Can I pay the rent? Can I put food on the table? These are real concerns that people have. And whether it's a short, sharp shutdown or a longer one, what we found out last year that worked was JobKeeper. There's almost in the mental health community discussion about what we're calling the JobKeeper factor, where JobKeeper actually was seen as a direct benefit in handling people's mental health and indeed in reducing suicides. So people's financial security cannot be underestimated as a driver in their mental health. It is so significant.
Dr. Burgess, the lockdowns, vaccination drives, adherence to restrictions rely very heavily on people's goodwill. Is there a point at which that goodwill starts to wear off, and what can be done to stem that and to improve people's sense of a common purpose to get through this period?
There's been a great deal of confusion about the vaccine and also about the purpose of the lockdowns. So I think greater transparency about those matters will help people have greater sense of certainty and trust, and that will lead to stronger mental health for people.
John Brogden, hope is a key factor here right now, isn't it? It's really important at a time when we're all, me included, doom scrolling all day.
So people are struggling at the moment. We all feel this, no matter where we are across the country, that 2021's a lot harder than 2020. We hoped that we'd got through the worst of it last year, and our hopes have been dashed. So it is very, very significant that people need to hold on to some hope through this difficult time. And look, the message is we will get through this.
Dr. Burgess, finally to you, what's your best advice for people at this time watching this crisis unfold without a promise of exactly when it's going to end?
I think it's really important to have a daily COVID plan about how you're going to self-manage, to look at the things you can do that brings bits of happiness into your life, which is listening to music, eating well, sleeping well, reaching out to other people, either to offer support or seek support, and connecting with people each day.
Dr. Zena Burgess, John Brogden, great to talk to both of you. Thank you.
Thank you.
Thank you.
It's now been nearly 7 weeks since Greater Sydney went into a lockdown that was meant to be a circuit breaker for the Bondi cluster. Instead, it's ended up with its worst week of the pandemic, and lockdowns this week expanding to regional New South Wales. The daily case numbers are now consistently more than double what they were when Premier Gladys Berejiklian declared the situation a national emergency. The New South Wales government is continuing to manage the situation region to region without a so-called ring of steel around any city or town.
There aren't any shortcuts to lockdowns. You've got to make them work as best as you possibly can.
But despite the state of crisis, Gladys Berejiklian is staying optimistic because vaccination rates are climbing.
What the end of August means is if we have 6 million jabs, it gives us opportunities to think about how we can ease some restrictions that we currently have.
Now, that optimism you see right there isn't shared by other state leaders who are keeping their borders firmly shut and insisting New South Wales doesn't go it alone in living with COVID. So what happens next will have serious and lasting implications for the whole country, for interstate borders, the economy, the cost to all taxpayers in supporting affected businesses, not to mention the risks to those who can't or won't get vaccinated. A New South Wales Parliamentary Committee has been trying to get to the bottom of how this crisis began. Labor and Greens MPs wanted to know when the New South Wales government was first advised to go into lockdown and how long the government took to respond.
We've provided a lot of that advice through crisis cabinet processes, so I'm not sure that I can specifically release those.
We're not going to release crisis cabinet documents or cabinet documents to you. If you want to be part of the government, join the government.
So there's a lot that remains unclear about how we got here and where we're headed. Let's bring in Ashley Raper, our state political reporter in New South Wales. She joins us now. Ashley, a lot of people wonder around the country how it's possible to be 7 weeks, nearly 7 weeks into a lockdown and still have consistently every day more than 100 people infectious in the community. How does the New South Wales government explain that?
Jeremy, we have the 11 o'clock press conference every day, but really the Premier or her ministers or the Chief Medical Officer don't really effectively explain why the numbers are so bad 7 weeks into lockdown. yes, compliance is an issue. These rules only work if people follow them. But the issue isn't as simple as that as well. The government and also health authorities have had difficulty connecting with certain communities, multicultural communities, and that has been an issue that they've known about. It was an issue last year, it was an issue during the lockdown in Melbourne, and there has been a failure here quite early on in this outbreak to effectively get into those communities and express the rules and really talk and get into these communities. Now, in terms of the compliance issue, we understand that police are looking at the rules and working out where they can be tightened. But in terms of the government response as well, Burgess really says that there is no plan B with what they're doing. They're not really looking at how to change strategy here, whether they need to tweak the lockdown more. They have gone tougher in certain suburbs. They've done this targeted approach. There've been more local government areas locked down this week. But every time we talk and look at why things are bad and when it's put to the Premier in terms of, how are you going to get on top of these numbers? What are you going to do? She's pivoting to vaccinations. And it's an interesting message when things are so bad to give this almost message of hope. And she set this target about a week or so ago that in August, she wants, Burgess wants everybody to get vaccinated in August. She wants August to be the month of vaccination. She set this target that there should be 6 million vaccines done in this month. And if that does occur, then she has suggested some restrictions will ease. Now, she won't say what they are, and the suggestion is the restrictions will be quite small, but it's an interesting way of communicating with people. Yes, it is providing hope, but it's a very grim picture at the moment here in New South Wales.
So where does this all leave New South Wales's relationship with the rest of the country?
Well, the federal government and also other premiers, and there's been a number of federal ministers come out this week to really criticise the New South Wales 50% vaccination target. Now, Burgess hasn't been clear exactly what happens if New South Wales reaches this 50% vaccine target at the end of the month. But she has consistently said for almost 2 weeks now that something will happen. There'll be some rewards, some restrictions will ease. Perhaps it's more services, like perhaps hairdressers may reopen, or there may be certain areas in the city that haven't had a lot of cases. They might have some of their rules relaxed, but there have been a number of premiers that have come out, and there have been a number of federal ministers who have come out to say if there is such high level of case numbers in Sydney and New South Wales in general, and they ease restrictions, borders are going to stay shut for a long time. If New South Wales breaks away in this way and really goes its own way and still has a lot of the virus circulating in the community while easing restrictions, then they're going to become very isolated from the rest of the country.
The other big development of the week, Ashley, has been the entry of Delta into regional areas. Is that a big concern for the New South Wales government?
Look, this is a huge concern. They're extremely stressed about the situation that is unfolding, especially in Walgett. Now, there have been cases in regional areas, and we have a number of lockdowns in a number of regional communities. They've managed to keep it out of regional communities for such a long time, but now 7 weeks into lockdown, that has not been the case. But in terms of, there have been cases in Dubbo, which is in Western New South Wales. Now, that is a big centre, but from Dubbo, it's also gone into Walgett, which is a much smaller community, and it also is quite remote, and there are huge challenges around that in terms of it has quite a substantial Indigenous population there. It's also remote, so there's a number of problems with health services there, and the government has been quite honest that they cannot cope. If there is an outbreak there, the health services that are in place in that community will not be able to cope with that. Now, there's an issue too, because with the Indigenous population there, now they are a priority to get vaccinated, and it's come to light that about 8% of the population has been vaccinated. So there's a lot of questions being directed at the federal government and to a lesser extent the New South Wales government, how they could have left this community so exposed. And if this does become a problem in Walgett, the consequences will be devastating.
Ashley Raper, thank you. And that is the vaccine for this week. You can catch up with the show anytime on iView and the ABC's YouTube channel. From all of us, stay safe. Thanks for your company.